Let's dive into a really strange puzzle in medicine. How is it possible that taking just one extra pill of a common drug can be the difference between it helping you and it hurting you? Turns out it's all about a hidden switch in our own biology.
So here's the mystery, right? You'd think that if you double the dose, you get double the effect. Makes sense. But for some really common medications, a tiny little increase can make the drug levels in your body just skyrocket into the toxic range. How does that even happen?
Well, the secret isn't actually in the drug itself. It's in us. It's a story about what happens when our body's internal machinery, the stuff that cleans everything up, gets completely and totally overwhelmed.
So first up, let's explore this dosing puzzle. We need to see where this hidden risk actually shows up, because I guarantee you it's in some surprisingly familiar places. And look, we're not talking about some obscure experimental stuff here. This risk applies to things you might have in your medicine cabinet right now, like aspirin, or even alcohol. But it's also true for critical, life-saving drugs for things like seizures or asthma. At low doses, they behave exactly as you'd expect. But at high doses, the rules just completely change. Okay, so to really get why things go wrong, we have to start with how they're supposed to go right. This is our body's default setting for handling most things we put into it. It's a process called first-order kinetics. In plain English, this just means the more drug you have in your system, the harder your body works to get rid of it. The key phrase to remember here is constant fraction. Your body might get rid of, say, 50% of the drug every hour. So if there's 100 milligrams, it removes 50. An hour later, if there's 50 left, it removes 25. It's always clearing the same percentage. Think of it like a big water tank with a giant drain pipe at the bottom. The more water you pour in, the more pressure there is, and the faster it drains out. This system has basically unlimited capacity to handle whatever you throw at it. And this system is beautiful because it's so predictable. The half-life, that's the time it takes to get rid of half the drug, is always the same. Clearance, how efficiently your body cleans the drug out of your blood, is constant. And the most important part, the response is linear. You double the dose, you get double the effect. It's safe, it's reliable, it just works. So if we were to actually graph this process, it would have a very distinct shape. And here it is. You can see that constant fraction idea in action. The curve is really steep at the beginning when the concentration is high. Your body is clearing out a ton of the drug. But then, as the concentration drops, the curve gets flatter and flatter. The body is removing a smaller amount because there's less to work with. It's this nice, predictable tapering decline. But what happens when that unlimited capacity system suddenly hits a wall? Well, that's when things get weird. We enter the unpredictable world of zero-order kinetics. The game is completely changed. Now, the body can only remove a fixed, constant amount of the drug, say 5 milligrams every hour, period. It doesn't matter if there's 50 milligrams in your system or 500. The cleanup crew is working as fast as it can, and it can't go any faster. Let's go back to our water tank analogy. It's like we've ripped out that giant drain pipe and replaced it with a tiny little coffee stirrer. It doesn't matter how much water you pour into the tank, it's only going to drain out at one slow, fixed speed. The whole system is saturated. It's totally maxed out. Seeing these two side by side makes everything so clear. That curving line is our predictable first-order kinetics, tapering off nicely over time. But look at that straight line. That's zero order. It's a straight, unyielding linear drop. Your body is just chugging along, removing the same fixed amount, which means the drug concentration stays dangerously high for a lot longer. So are these two completely separate rules that our body follows? Nope, not at all. In fact, they're two sides of the very same coin. And it's all explained by one surprisingly elegant bit of science. And here is the big aha moment. A single drug can literally switch from the predictable first-order behavior to the dangerous zero-order behavior. The only thing that has to change is the dose. It all comes down to how swamped the body's little drug-clearing enzymes get. This whole switch is described perfectly by something called the Michaelis-Menten equation. Now, don't worry about memorizing the formula. Just get the big idea. It shows how the elimination rate is connected to the drug concentration. The key part is that Vmax. That is literally the system's maximum velocity, its top speed. It's the absolute fastest the enzymes can work before they're just completely tapped out. So here's how it works. At low drug concentrations, no problem. The system has plenty of spare capacity. It follows those predictable first-order rules. As the dose goes up, you hit this kind of mixed zone. But once the concentration gets really high, the enzymes are completely swamped. There's a traffic jam. They're all working at their top speed, Vmax, and the system gets locked into that constant, risky, zero-order elimination.
Okay, so that's the science. But let's bring this all back to the real world because understanding this switch is absolutely crucial for keeping patients safe. This table just puts it all in sharp contrast. Look at the first order column. Constant, proportional, linear. Predictable. Now look at the zero order column. Constant rate, but variable half-life, variable clearance, and a non-linear dose response. It's chaotic. And that's the heart of the problem.
And here is maybe the most shocking real-world example of this. For the anti-seizure drug phenytoin, the body's cleanup system gets saturated at a concentration of just 4 to 8 milligrams per liter. But the dose you need for the drug to even work is between 10 and 20. Just think about that. For this drug to be effective at all, you have to dose it at a level where the body's elimination system is already redlining in the zero-order zone. So you can see the danger, right? With a drug like that, a tiny, seemingly innocent increase in dose can't be cleared any faster. The body has no extra capacity, so the drug just builds up and up and up, leading to this huge disproportionate spike in concentration and potentially toxicity.
And if you take away just one thing from all of this, let it be that. You have to know which drugs play by which rules, because assuming everything is linear and predictable can have incredibly serious consequences.
But let me leave you with a final thought to chew on. We've been talking as if these rules are the same for everybody. But what if they aren't? What if, because of your unique genetics, your body's top speed for clearing a drug is different from mine? That would mean the line between a safe dose and a toxic one could be in a completely different place for every single one of us. And that's a whole other puzzle.